ضربة الحادث، أعصاب، كهرباء، حرق، نيلز، أشواك، فهذه كانت الآلام.
When he came to us, he was in a lot of pain. He had multiple fractures in the body. He was totally dependent for his care.
Ahmed, and we have to see where and how we can improve his condition.
أكيد حسيت بإحباط، أكيد نفسيتي كانت متدمرة.
How did he feel about accessing community and society and that image of the limb, and how did he reintegrate that with his overall sense of himself?
كان الصعب، ما بقول التقبل، بس كان الصعب إني أصدق إني أنا هذا. ابتدت قصتي بحادث سير مأساوي مروع بشع، من خلاله انبترت رجلي اليمين فوق الركبة.
This young man was unfortunately involved in a road traffic accident which resulted in fractures of both his legs, fracture of the collarbone and fracture of the shoulder bone. He also had to undergo amputation of the right leg above knee.
وبعد 8 أيام لما فتحت عيني وشفت شفت حالتي إني أنا عاجز ومكسور وضعيف.
He was medically stable, but he wasn't independent. He didn't have any functional independence. So he came to Amana to have rehabilitation to help him regain his independence and get fitted with a prosthetic limb.
As a team, we have to initially assess Ahmed, and we have to see where and how we can improve his condition. It wasn't easy because he had a lot of emotional pain as well as physical pain. He had a lot of fear. Obviously, he had surgery, amputation, so there was a lot of loss and a sense of loss for Ahmed. So this all, as a team, had to be addressed initially.
In elderly patients, the most common cause of amputation these days is vascular reasons. So patients who have diabetes, they undergo amputation because of impaired circulation in the legs. But if you look at the younger age group, the most common cause, like Ahmed, is trauma. So whether it is road traffic accident or any other accident.
Well, from a psychological point of view, having an amputation is a life-changing traumatic event, and it can have quite a big psychological impact. Can be lots of anxiety about what the future looks like, how somebody's going to manage, and just really getting used to a new sense of yourself with a change in your body image.
أكيد حسيت بإحباط، أكيد نفسيتي كانت متدمرة، خصوصاً أنا شاب في بداية العشرينات أفقد طرف من أطرافي المهمة. كان الصعب، ما بقول التقبل، بس كان الصعب إني أصدق إني أنا هذا. كان وايد صعب.
When he came to us, he was in a lot of pain. He had multiple fractures in the body. He was totally dependent for his care. He was unable to move even in the bed. So he required complete nursing care.
بس تمنيت للحظة أني أنا ما أكون عايش حتى أنا ما أشوف أو أتحمل الآلام هذه.
So some of my involvement was helping Ahmed to psychologically adjust to his injury and his body image, and also to support with pain management. So although he had pharmacological pain management, we also worked on some psychological techniques for helping to manage pain as well.
Psychologically, not in a good state, considering that he has lost one of his limbs, and he was going through a very difficult time.
Ahmed was complaining of a lot of pain. before he started his physiotherapy. So we had to put him on pain management, and with that it was well controlled.
آلام بشعة، آلام الوهمية، الفانتوم بين. أي إنسان يمر بإصابة أو ببدل رجل أو يد يحس بشيء اسمه فانتوم بين، آلام وهمية. رجلك موجودة، الأعصاب متوصلة. أنا حين قاعد أتكلم أنا أحس بأصابعي لين اليوم.
Ahmed had a lot of phantom limb pain, which is pain where there was surgery and there was pain where the limb was no longer present. Oftentimes this can happen particularly after a traumatic incident, an episode, as happened in Ahmed's case.
After amputation, I have a very peculiar type of pain, which we call phantom pain. So this pain comes from the limb, which is not there, which has been amputated. And so there is specialized treatment programs for that kind of pain, and we put together that plan as well.
أنا اليوم أطلع من حادث مأساوي وأكون حي وبعدني ألتقط أنفاسي. كان في بعدها مثل ما يقولون شمعة الأمل لا زالت تشتعل، ما انطفأت.
Aim is to prepare the patient for prosthesis and amputee rehabilitation. So we put together a program of musculoskeletal reconditioning so that we strengthen the muscles. Bear in mind that the patient has been in ICU and has been bedbound for some time, so there's deconditioning of the muscles. So the first thing is to make sure that we improve the muscle strength.
قاسوا مدى الحركة العضلية اللي عندي، قوة العضلة كم، فكان شيء بروفيشنال، مش حي الله تعالوا يلا ابدأ بالعلاج، لا درسوا حالتي من ثم تم وضع لي خطة علاجية.
Rehabilitation program from the amputee rehabilitation point of view, we broadly divide it into 6 stages. So these patients initially go through a pre-amputation stage, then they go through the operative stage, then the third stage is acute post-operative stage, fourth is the pre-prosthetic stage, fifth is the prosthetic stage, and sixth is long-term follow-up and maintenance of the patient.
Help him think about his kind of psychological adjustment to that. So how did he feel with the limb in terms of his body image? How did he feel about accessing community and society and that image of the limb, and how did he reintegrate that with his overall sense of himself?
So this was part of his rehabilitation too. We used mirror therapy so he could see that when he was moving his limb that it wasn't causing harm, and we used different techniques to try and reduce his anxiety to movement during his rehabilitation. So there was a lot of fear involved initially because it's such new and a new stage in his life.
He was able to participate on his daily therapy schedules, and we have to encourage him to do as much as possible with the things independently.
And one of the things I think it is very important to say here is that the rehabilitation process is a very complex process. It requires a team of professionals, including rehabilitation physicians, specialist nurses, specialist physiotherapists, occupational therapists, clinical psychologists, and in this case, because of amputation, a prosthetist.
الفريق اللي كنت معاهم قبل لا يكونون هم معالجيني، نحن صرنا أصدقاء.
So initially, week on week, we met as a team and we met with Ahmed to go through his progress to date. And we had to set individual goals for Ahmed and to show him to setting these goals, which were his goals, to try and achieve his ultimate aim of independence with a prosthesis.
The prosthesis provision, it actually took a while, but with the training on how to use the prosthesis, he actually started on it because his wound is already healed. So we're able to use some of the equipment that will actually help him out when he already has his own prosthesis.
I was specifically involved in helping him with psychological techniques to help him manage his pain as well.
Because bear in mind, this is a life-changing situation, especially for a young man to lose one limb, because it's going to impact the rest of his life.
أول مرة ركبت الطرف الصناعي كان الشعور ما ينوصف. مجرد ما أنا ركبت الطرف حسيت الآلام الوهمية قامت تروح عني.
Ahmed was provided a prosthesis once we worked on his physical, emotional and psychological improvement, and once he was ready we prescribed him with the above knee prosthesis.
كان عبارة عن حديد ويحطون رجلي المبتورة في بالون، ها نوع من العلاج عندهم حتى أنا يعلموني كيف إحساس الطرف الصناعي. فيس بدو الشيء هذا يعني من الأشياء اللي ساعدتني إني أنا أعرف كيف يكون شعور الطرف الصناعي.
There's a lot of steps that need to be taken in order to build the strength, education, and preventing contractures of soft tissues, and building the stability, the core stability required, and the upper limb strength required in order to be independent in transfers and activities of daily living.
ما كان الشيء سهل إن الواحد يلبس طرف صناعي ويمشي، لكن كان الشيء سهل أن الواحد يقدر يوقف على رجلين لو كانت واحدة اصطناعية والثانية طبيعية. فكأن نعمة انزاحت مني ورب العالمين اليوم يهديني إياها بأطراف صناعية تصنعت لأجلنا نحن.
In achieving the goals, this really motivated Ahmed to move to the next level, and this is part of his journey to recovery to where he is today.
It worked well on him that he was able to regain his confidence and independence while he was on this rehabilitation program.
I think Ahmed is a very brave young man, in spite of all the difficulties and multiple injuries that he sustained. Once the initial period passed, he engaged very well with the therapy team. His rehabilitation, I would say, is extremely successful.
مش نظرة معالج ولا دكتور ومريض، كانوا مثل بيئة ودية عائلية كانوا هني.
When he left us after a period of inpatient rehabilitation, he was walking with a prosthesis with the help of crutches. And in that short period of time, he made tremendous progress.
And Ahmed can be very proud, and I think returning to his activities which he enjoys to do, going to the gym, cycling, driving, all these things are a massive achievement for Ahmed and for his family and for his support structure and friends too.
definitely a success story. He's back doing everything that he was doing before and more. He's confident in himself, and he's also a really good example. He's a patient partner for us here, so he also supports other amputees in their journey to recovery as well.
Absolutely, I would say that he's an exceptional young man who, even after sustaining so many injuries and fractures, worked so hard with the prosthetic team and the rehabilitation team, I think his rehabilitation in all aspects has been very, very successful. He's mobile with his prosthesis and he can get on with his life.
كتب لي عمر جديد وفرصة جديدة وتجربة جديدة. فوق 20 سنة أنا جربت الشعور المشي على الأقدام، واليوم أنا أجرب تجربة أني أنا أمشي على طرف صناعي ورجل طبيعية. أحس بشعور اللي عنده أطراف واللي فاقد أطراف.
It is like a rebirth story for him with what he had underwent and then the new life that he has come up with now. So definitely a successful story.
For sure, in Ahmed's case, he is more than a survivor. To come from where he's come, the trauma which he suffered, at the level of which he was at when he first came to Amana to where he is now, returning home, independent with a prosthesis, is very difficult.
Absolutely, Ahmed is a survivor. With all the things that he have gone through, he is well deserved to be called a survivor.
To see him back at work and back being physically active is definitely a success story.
كتب لي عمر، كتبت لي حياة جديدة، فرصة جديدة وتجربة.
It's not easy. It's a very difficult journey, and he really pushed forward. He grew as a person, and he's really done well.
المواقف اللي الصعبة أو اللي نحن نقول عنها أو الناس تقول عنها مشؤومة، تأكد بأن هذه بداية طريقك إلى النجاح. ومش من السهل إني أنا أمشي بقدم واحدة، لكن من العيب أن تعيب حياتي من ابتلاءات رب العالمين.